Hello and welcome to Pulse Check with Archer Nursing, where nursing comes to life. In this podcast, you give us 15 minutes of your day, and we'll take one complicated nursing topic and make it easy. Ready for nursing to be fun? Hello, everyone. I'm Morgan, and today on Pulse Check, we're going to talk about something a little different than our usual episodes. We are going all about advocacy, which is a word I'm sure you hear a lot. But we really want to zoom in today on what it looks like for you as a nurse at the bedside, in your advanced practice role, out in your community, so on and so forth. You know, what it really means for you. So joining me today to dive into all things advocacy is our wonderful Director of Advanced Practice, Hiva Kaz, who brings both frontline and leadership perspectives to our conversation. And you probably recognize her from the podcast. She's been on a few times. So welcome back, Hiva. We're so happy to have you here.
Thank you for having me back. I'm always impressed by how you're able to pronounce my last name. That's always fun. You're spot on.
So funny because every time I look at your last name, I'm like, oh, it's spelled exactly how it sounds. Like it's like phonetically spelled.
Yeah,
so I think it's an easy one.
I can tell
love
people
it.
always like skip a beat when they see the last name. It's like you take a
oh.
breath in, like, all right, here I go.
Amazing. Well, I'm so glad you're here. I'm so glad we've got your last name down, and I'm just so ready. This is going to be a great conversation. I know when I personally hear the word advocacy, it is easy for me to get overwhelmed by thinking about all the different things that can mean, and honestly feeling like it can be very time consuming. And most of us don't have a lot of spare time on our plates. So I would love to just start off with a candid conversation about what that word means to you as a nurse, as a mom, as a FNP, and kind of take it from there.
I love that. 100%. When you and I were first talking about this podcast episode, we're thinking, okay, advocacy, like you said, it gets thrown around a lot. And I think as soon as students hear it, especially students who are in the thick of it, they tune out because they're like, oh my gosh, that's something that's for later. I'm nowhere near getting ready to advocate for nurses in my profession. But I was really thinking about it, and advocacy really starts with self advocacy, right? And it really stems from there. So when I hear advocacy, I also think politics and policies. But then I really have to go into it and be like, well, wait a minute, let's sit with this for a minute because I think it really starts with self advocacy, right? Because we have to be able to advocate for ourselves on a day to day basis before we can then eventually, in a decade, 2 decades, get to that policy work, right? We'll get there. But really, this episode, I wanted to focus on self advocacy for you as a person and as a nurse. So that's my definition. That's my takeaway.
Love that. And as I sit here reflecting, I tell my students oftentimes, like, hey, you have to be your own advocate. If you've got a preceptor that you're not jiving with, if you're not getting what you need out of a clinical situation, no one's going to speak up for you but you. So I didn't even connect the dots that I feel like I use that word, go advocate for
Yes.
yourself. That is the beginning of advocacy.
Yes.
It's all on a spectrum, right?
Oh, 100%. And it's funny you mentioned I'm a mom, I'm a nurse practitioner. I just had this conversation with my daughter yesterday. So I have two kiddos, 4-year-old and a 7-year-old. My daughter's 7 right now. And she's starting to run into those issues at school with those social issues with friends, with peers, really being able to stand up for herself, and she's not able to get there. And she said to me last night, she said, Mom, can't you just call so and so's mom and tell her to give my stuff back? And I thought about it and I said, I said, this is actually where it starts because these are the conversations you practice with so that when the harder conversations come, you've had practice. And you have to be really kind with yourself because when you first start to have those conversations, they're going to be messy. They're going to be tough. This is not something easy. I mean, what you just said, speaking up when a preceptor's not treating you well. How many of us, and this is also something bigger that I want to talk about with nursing culture, but how many of us just cried at the end of the day, didn't show any weakness, didn't tell anybody. I remember one of my nurse preceptors made me cry literally every day. And then she wanted at the very end of the day, I mean, I won't go into the details, but finally, when my instructor brought it up, this was at the end of the rotation, she was like, "Why didn't you say anything?" And I didn't even know I could. Right?
Mhm,
I didn't
mhm.
even know that I had the ability to speak up, and I didn't speak up. And so really going through those hard experiences, I think is necessary. So really self-advocacy is where it starts so that eventually you can get to the bigger, more overwhelming policy and really advocating for our profession. But advocating for yourself is what it's really all about. That's where it stems from.
It's such a good point that I feel like that self-advocacy, you're your own best advocate. You have to speak up for yourself, particularly for nurses, is really, really hard. You just mentioned like that self-sacrifice, the like, I have to push through. I don't want to be the weak link or show any weakness. And I mean, curious for your input, but personally, I don't think that that's really doing us any favors. I don't think that, like, on a self advocacy level, we're really benefiting our education or our practice by just, quote unquote, pushing through. And then on the bigger spectrum, when we think about everything that's wrong in our system as a healthcare system in our country right now, pushing through is certainly not the answer, in my opinion. That's not going to get this profession in any better shape. But I mean, what are your thoughts, Hiva? Why is that self-advocacy so darn hard for us? We know it's important. What's the rub
Yeah,
there?
I think you touched on a lot of important points there. And I think that's why it gets overwhelming because when you start to think about it, it starts getting really magnified. It's not granular. And then you're like, oh, well, I give up. Like there's nothing I can do about this.
Yeah, my
You're
hands.
like, forget it. So I think that can definitely feel really overwhelming. But my take is, and I've thought about this a lot, especially since we've talked about like, let's do an episode on this because this is something that I personally have struggled with and something that I've personally had to work on. And so I come from a generation of nurses, a long line of nurses, as most nurses do. And I still remember my grandmother talking about her experiences as a nurse and how it's not right for everybody because there is that
Mhm.
self-sacrifice. So I think when you look at the profession and how it started, it is self-sacrifice for somebody else, right? That's how it is. And so she would describe that she would be in the middle of lunch and a patient would have bowel movements that she need to go take care of. And so that's why it's not for everyone. And it was almost like a source of pride of like, these are the things that I've gone through and I've done and I've sacrificed, right? And I think a lot of the culture, because it started there, has really transferred, and it's not just nursing. I see this in the medical field, this shame around being human and saying that I need
Sure.
to take care of myself. It's almost like you're weak and you can't keep up, and this is not the right profession for you. So look at
Mhm.
where that's gotten us, right? People are burning out, people are leaving the bedside. I mean, I think you said the statistic in an internal meeting the other day, and it's really sad, but most nurses stay in nursing for 2 years before leaving the profession. That that is a problem, right? And we need to really be thinking about, well, why? What's happening
Mhm.
here? And my personal view is it's the culture that we need to talk about. We need to normalize that we are also human and then talk
Yeah.
about the consequences that this is having on our system, right? If we have nurses leaving the bedside, of course we're going to have a nurse shortage. If we have nurses
Mhm.
leaving the bedside, we not only have a nurse shortage, but those nurses who are staying can't properly care for our patients. So this is also hurting patient care. And when it hurts patient care, it actually costs money. It's costing our system money. So it all plays in. So when you really think about it, there's no wonder this topic is so overwhelming to people, right?
Yeah.
But I really want to focus in and remind ourselves that you can control what you can control. And I
Yeah.
really want to talk about how can we self-advocate in the moment, whether it's in our training, in school, in jobs. How can we self-advocate in that moment? Because that does make a difference, even if it doesn't feel like it's making a difference.
Yeah, absolutely. It's those little baby steps. It's those micro actions, one little piece at a time. But something that kept ringing through my head as you were speaking was a phrase that I personally don't love and that I don't think does us much good personally or professionally, but you hear all the time. And that's, this is a calling. This isn't a career. This is a calling. And while many people do feel called to nursing and healing and helping, I still think that, we are professionals. This is a career. And the more that you just push that off and say, well, it's a calling, it's that self-sacrifice, it's that burnout, it's that putting yourself through moral distress because this is about some higher calling versus truly this is a profession. And I don't think we're doing ourselves very much favor by not acknowledging that, not advocating first for ourselves. And then I think you did a great job of showing how that then ripples in to the systemic issues of, staffing and, having the proper equipment on your unit, being able to work with your schedule as you need to accommodate your family, all these different pieces really start to pull together.
Yeah, it's funny. What if we flip the script and said it is a calling? Because I do feel like I was called to the profession. But I think that really talks about the person and why you go into nursing. So I don't want to lose the fact that it's a calling because I do see some nurses treating it as this is my job and they've lost that empathy. So that worries me a little
Sure.
bit because
That's fair.
nursing, I still feel is a calling. But it
Mhm.
reminds me now that I'm a mom, it's so parallel to that, it's kinda crazy, because as a mom, as a new mom, I self-sacrificed so much, and then I started to burn out, and then I saw the negative impact it was having on my kids with their expectations, and I wasn't serving them because they weren't being independent enough, and I realized that, okay, this is a calling. This is something that I want to heal others. I want to raise thoughtful, intelligent, kind humans. I want to care for my patients. But in order to do that, I need to care for myself first so that I can actually fill somebody else's cup. Because if your cup is empty, you have nothing to give. And that truly, oh, I just got chills saying that because I had to learn that the hard way in so many different ways in my personal life, in my professional life.
Sure.
And I continue to struggle with that because I think as nurses, it is a calling and our intuition is always to give before we take.
Yeah.
And I
Yeah.
think life, your body, everything has a really, you know, it's not ironic, but it has life has a good sense of humor. It reminds you in very different ways that you are human and you can't just
Sure.
keep filling somebody else's cup. You need to take a moment and fill your cup.
Yeah.
And I think
Yeah.
that's what we have to remember as nurses. Yes, we got into this profession because we want to help our patients. We want to help
Right.
people heal, right? But we can't do that if we're not doing the same for ourselves. That
Yeah.
should be number 1, and we need to normalize that behavior because it's not just in nursing. I see it with my physician colleagues, I see it with PAs, I see it everywhere in my profession, and it's the culture of the healthcare industry that we really need to flip on its head. Yeah.
I like that. Let's flip the script and maybe not just like totally ditch this is a calling, but maybe it is an and statement, not an or statement. Yes, I felt called to this profession. And yes, it's a career where I'm still going to prioritize myself so that I can fulfill and really care for my patients like I want to. I've been working on this a lot on it can be two things at once.
Yeah,
It can be an and statement.
yeah, yeah.
I feel like a lot of times we think it's like this or that, and that's not always true. Like life is messy. It's sometimes multiple things at once.
And
Yeah.
Morgan, you will know this so much more as things evolve in your life, and this is something that I talk to my kids about all the time is like and I love this generation where they focus on kindness and being good humans, like, what a blessing, right? Like, so not only is our generation healing from our own traumas of being taught a different way of, like, self-sacrifice and having to push to make sure you're the best, But this generation not only focuses on that, but it also normalizes two things at once. And so the way they really normalize is with feelings. It's like you can feel scared and excited. You can feel
Yeah.
two feelings at once. And so, really, again, I think with our generation, we just have to continue to normalize it the way they are for the younger generations so that we can see those small micro changes, right? So,
Yeah.
just normalizing, like, yes, I love this job. I love caring for my patients, but I also love me and I love my life. And I don't want to die or have, I mean, that's like the grim aspect, but
Right. It's my reality though.
something that's gonna knock me out, right? I don't wanna have, like, health issues, X, Y, and Z because I'm not caring for myself, and, I mean, just yesterday, I was thinking about it because where everyone is going through this right now. I was like, "Okay, pause, go eat something so that you can continue to work." Because if you just keep going right now, this is not going to help anyone. This is not gonna serve anyone because you are going to run on empty and then that's it.
Yeah. You're gonna crash and
You're
burn.
gonna
That's
crash
it.
and
That's
burn.
it.
So and it's fun because
So
as I said, and I think I learned this in my mindfulness practice, like, the body really has a powerful way of speaking to us, and I get knocked on my butt every so often because I forget. And then I have to keep working at it. So this is something that we have to keep working
mhm,
at. It's not something that comes naturally. It's not something that once you learn it, it's learned, that's it. We have to
mhm.
keep practicing, and don't worry, life will remind you.
It sure will. It sure will. So does self-advocacy start with little actions as simple as feed yourself, water yourself, make sure you take rest? Like, can that be step 1? We talked earlier about, we wanna break this down, make this really practical. Is that step 1 in your opinion?
100%. I was thinking about this morning as I went for my power walk instead of answering more emails. I said, "Okay, I'm gonna go for a power walk. Let's, do the things I preach. I'm gonna do it." And that is exactly it rang true to me. I said, "Okay, self-care, meeting your needs is self-advocacy," right? We tell our patients to do that. We say, "You need to be your own self-advocate. When I'm not there, you need to speak up and say, 'This is what I need.'" Well,
Yeah.
we have to do the same thing. Why? Because when we say to ourselves, "This is okay, getting my
Mhm.
needs met," these are things that are like, I deserve this not because I think I'm special, but because I'm human and I love myself, and these are the things that are appropriate to want, then we can do a better job of when those lines get crossed with our employer, with our friends, colleagues, whatever's happening, we can then self-advocate and say, "Hey, like, actually, I need to do X, Y, and Z." And
Okay.
that's
Okay.
okay. Because if you don't even feel like you can justify that in your own head, in your own body, in your own mind, when somebody questions you on it, how quickly are you gonna cave?
Yeah.
Right?
Yeah, totally. Really
Really
quick.
quick, and we've all done it because we're all like, "Oh, you're right, like, I should work harder and I should do better." But if you justify it for yourself and say, "No, I need to eat, I need to drink, I need to sleep, I need to say hi to my family, I need to not be grumpy, I need to get exercise." These are basic needs, human needs to function. When somebody crosses that line, you say, "Look, I love this job. I love what I'm doing, but when I'm on a lunch break, let's
Yeah.
talk about how we can cover each other so I can take my lunch break, so I can fuel my body, so I can get back to my patients with a clear
Oh,
mind."
that's a great example, especially for if any of you are new grads working at the bedside. I have seen so many different cultures around lunch breaks in
Oh my
different
gosh.
hospital systems and different facilities. And I think that is a really excellent one to advocate for, like having that proper coverage, having each other's backs so that you do get that time to really just feed yourself. It's as simple as
As
that.
simple as that, but it comes back to my grandmother, her generation. She's giving me an
Yeah.
example of her lack of lunch break, right?
Yes.
And how many times as a new grad, I remember I would go full shifts, not using the bathroom, drinking
Oh,
water,
100%.
or eating. And I just thought that was normal. And my body, I mean, I was much younger at the time, but my body, even at that point, like it would knock me out until my
Yeah.
next shift.
Oh,
That is
absolutely.
not normal. And we have normalized that. So let's flip the script. Let's normalize taking care of ourselves so we can take care of others. Because I guarantee today I feel a lot more productive having gone for that power walk. And I'm going to get more done and I'm going to get it done with a clearer brain than if I
I
had
love that.
pushed through. And, I test this all the time. I experiment on myself all the time. I push through and I'm like,
My own
oh,
guinea
be
pig.
fine. And then I get reminded I'm human. My body reminds me. And I'm like, okay, going back to
Woo.
there.
Back to the start.
So I
I love it. I love it. So we've got some really great starting points for that self advocacy. Now, let's take it just one baby step further. How do you then not just advocate for yourself, but maybe for your group of nurses? Maybe we're not even advocating for the entire profession of nurses. Maybe it's the group of nurses at your hospital, but I have to think, so like I'm thinking about this in like concentric circles of like it starts in me and my body, and then it starts with those around me, and then it kind of goes out from there,
Yeah.
hopefully,
Yeah.
so that because I do absolutely believe each of us needs to be advocating for this profession.
Yeah.
But how do we get there? Like, oh my gosh, people are probably feeling overwhelmed already.
They're like, "Tune off, I can't listen.
Like, like, stop this episode right now.
I can't even think about it." I think it's great that we're airing this episode in the summer, early summer, because that's right around the time where a lot of students are graduating, looking for their first job. So they're either recently graduated or about to graduate and looking for that first job. And I think what you said was exactly right. We're not talking about advocating for the whole nursing profession. So, with that self advocacy, if you advocate for yourself, you can look for those healthy roles. You can look for those healthy cultures. And it really comes down to like your group, whoever is on the same shift as you, right? And there are always going to be those nurses where you're like, oh man, she's going to make my shift a nightmare. I do not wanna
That's
be on a shift with her, and we all know those nurses, but you know what? Kindness goes a long way, and I think strength in numbers, and one thing I really, it bothers me because 'cause I'm always the one who's speaking up. Stand up with your fellow nurses. It's scary, right? But don't just talk on the back end, be transparent on the front end. And why people don't speak up and they're not candid when it matters is fear of losing their job, fear of having a bullseye on their back. I remember a colleague kept saying to me, Hiva, you're putting a bullseye on your back. Do stop saying things. And meanwhile, she was telling me everything in, in private. And I said, here's the thing. If you don't speak up to improve your current floor, your group, your shift, whatever is happening, then what ends up happening is everyone's miserable and you either leave or you stay and you're miserable and it affects patient care and affects your job quality. If you speak up, what's the worst thing that can happen? You either best case scenario, people say, "Oh, you know what? You're right. Let's address this." Worst case scenario, which is why people don't speak up, they're afraid of losing their jobs. And now I know I'm
Absolutely.
coming from a place of privilege because many people can't afford to lose their jobs financially. So they're scared, right?
Yeah.
But if you don't speak up, then that one person speaking up is not gonna get anywhere. But if you speak up as a group and stand with your fellow nurses and say, "Hey, you know what? I've noticed that too. I really feel like X, Y, and Z, these processes could improve, and these are some solutions," and come at it from a place of you don't have to get combative or negative, but come at it with some solutions and say, "Hey, I've noticed
Yeah.
X, Y, and Z." And really speak if you're talking to an administrator, really speaking their language really helps because
Mhm.
they're just worried about, okay, how many patients are staying longer? We're getting dinged with credentialing. We're looking at outcomes, we're measuring outcomes. So you can say, hey, I've noticed these outcomes are declining when we're feeling like, okay, we don't get a break and we're not getting those fair patient to nursing ratios. What if we had this as a solution and coming at it with whatever's practical for your unit as a solution? And then when you say it in their language and say, you know what, I think this would improve patient outcome, this would improve patient care, then I think they're more willing to listen. And
Yeah, I think people are way more open to constructive solutioning. And I do want to just jump in and say I don't think you have to have all the answers in order to speak up and advocate, but if you come at it from a constructive angle versus just sheer negativity of this is horrible and I'm bashing this, that, and the other, no one wants to hear that, you know?
right.
That's just unpleasant and it's not likely to get you anywhere. But even if you don't have all the solutioning, come at it from that constructive angle, I think can get you a lot farther. Because if your intent behind the advocacy is not to just like trash
Right.
people, like this hospital is horrible, we have the worst staffing ever. Like your intent behind advocacy is I want to make this better for myself, for my peers, for my patients. So I think that angle and that intent can go a long way.
I think it can go a long way. And as you were speaking, I was thinking, but in order to be able to do that, you have to be taking care of yourself. Because if
Yeah.
you're burnt out, if you're overworked and you're angry, there's no way you're coming to the table with an open mind. And
Yeah.
I've been there, I can say that personally. So in that moment, that's when you need to I think step 1 is self-advocacy, and step 2 will be able to come at it with curiosity of like, "Well, how can we improve this process to make it better for everyone? Make it better for ourselves, our colleagues, our patients." But you need to have that step 1 in order to be able to do that. So bringing it back to like, what can I control, right? I think that's
Absolutely.
important to remember.
Amazing, amazing. I love it, and I wanna be conscious that I know we're running out of time, and we could probably do a part 2, 3, 4, 5 with so many more. But one of the questions that we had bounced back and forth that I wanna make sure we hit on is, what kind of advocate do you want to be remembered as? What kind of advocates are there? And where are you gonna leave your mark?
Wow, I love that because I ask myself that every day. I'm like, what are we doing here? Like, what's the end goal, right? Like,
Yep.
and I think for me, the reason why I got into nursing is because I want that one to one. So I don't even care if like a whole group of people don't remember my name, right? Like, I don't want to leave a legacy. I don't want to throw my name on everything as we're seeing in our politics today. I just wanna make that meaningful difference for one person, right?
Yeah.
And so I think that's what me personally, when you're asking me, that's what I wanna be remembered as, that I made a difference in someone's life, and that starts with myself, and then that way I can make a difference, meaningful difference in someone's life, and it's those relationships with my patients that I remember. And those patients that really got something, we had a goal and we met that goal together, and that's what lights me up and makes me so happy. So for me, that's my answer. What about you, Morgan?
I love that. And there's so many ripple effects from that, Hiva, because it starts with you at the center with that self-advocacy and every one-on-one interaction that you have, every life that you touch, it really ripples out from there, which is a beautiful thing. For me, the phrase that I use as like my mantra that keeps me going is to leave the nursing profession better than I found it. I'm intentionally very vague about that because there's about a zillion and one ways that we can better the nursing profession. And even just saying that might be subjective. What looks better to me might not be better to you. But I think why it sticks with me is that it's a focus on progress over perfection. We're never going to have absolute perfect ratios and staffing and the best system and blah, blah. There's always going to be room for improvement. And I think acknowledging that actually is more beneficial to continual improvement. So I always say 1% better every day. I'll take like half a percent better, even just like a little baby little step. If we can just find ways to facilitate that together.
Love that.
Um, so amazing, amazing. A few key takeaways that we'll leave you guys with here because I know we're running out of time. I think important to call out that advocacy is a part of everyday practice from you as a person to the bedside and then out beyond into the community and policy. And the biggest key takeaway for me is that all those ripples start from within. It's about you, self advocacy, taking care of yourself, supporting that safe, sustainable care. And that's going to be the starting point for all those other wonderful things.
100% Morgan. And I think one thing I want to leave our listeners with is making sure that they ask the questions. That's one other piece about
Yeah.
self advocacy that you were asking. Well, how do you make sure when students are looking for their first job, or if you are a nurse that you're in a role that you're not happy with and you've been in this role for a long time, or a nurse practitioner looking for your new job or looking to change your career or looking to change because you're just not happy. What I always tell my students and those that I mentor is ask the questions. Ask those
Mhm.
safety questions that you would want when you're operating on a day to day. And it's really hard for new grads to know what that is because they haven't been doing it on a day to day. And things will come up as you get that work experience. Be
Sure.
gentle
Yeah.
with yourself. That's learned experience. It's okay. What I would say is in those interviews, when you're talking, ask the questions. And if you are worried, well, I'm going to lose the job because I'm asking these questions, that's okay. Then you are saving yourself a lot of hardship, right? The
Probably a job you didn't want.
job that was going to make you miserable. So ask those
Yeah.
questions. I will say there's no perfect job. Go into
Mhm.
it knowing that there's no perfect job. As long as my big thing is safety, as long as you feel like you can practice safely and you are being heard and you can come to the table with solutions, ask that question. How do you guys implement change on the floor in a process, right? For a nurse manager to hear that, for a hiring manager, when I hear that, I'm like, okay, this person's coming with solutions. This person's not going to be a thorn in my side. They're coming with solutions to help me tackle this issue. So
Yeah.
ask the questions. Don't be afraid. Be patient when you're getting that job. And if you're in a job that's not going well, do your best to stay calm, self advocate, and try to make a difference. But at the end of the day, don't be a martyr, right? Like, if it's something where you've tried in so many different ways, it's okay to walk away and say, you know what? I literally did everything I could. And it just
Mhm.
is not the right environment for me anymore. That's the end of this chapter. And I promise you, there are going to be so many more chapters. I mean, you and I have talked about this in other episodes.
Yeah.
Nursing has so many chapters. So
So many
it is a
factors.
place
Yeah.
of privilege to say that again, to be able to walk away from a job or switch jobs. But it comes back to yourself and self advocacy. Be gentle and kind to yourself. You deserve to work in an environment where your calling is supported. And that's where it comes from.
That's the truth. Absolutely. You don't have to do everything, but you can definitely do something,
Yeah.
and it starts with
Yeah.
yourself. So, thank you for tuning in. I hope that this was a helpful conversation to bounce things around. Thank you to Hiva for joining us for a wonderful conversation on self advocacy.
Thank you.
And in the meantime, we will just see you back on the next episode of Pulse Check. Thanks for tuning in. All right, future nurses, that is a wrap. If you found this pod helpful, I'd love to continue supporting your nursing journey through nursing school, the NCLEX, continuing ed, and beyond. Archer Nursing has you covered with on-demand video lectures, high-yield question banks, live case study reviews, and so much more. We want to help you master tough concepts and make it fun. So join us over at archerreview.com. Follow us on socials at Archer Nursing for more free nursing tips and study resources. Thanks for tuning in to Pulse Check with Archer Nursing. I'm Dr. Morgan Taylor, and I'll see you back next time.